everything you ever wanted and needed to know about bariatric surgery, surgery that is required for people who have tried everything to lose weight and now they need to lose weight medically. I want to introduce the gentleman who's about to help us understand that topic. He is Dr. Alex Abkin, Medical Director, JFK for Life, Lifestyle and Surgical Weight Loss Program at JFK Medical Center. Good to see you, Doctor.
Pleasure being here.
Now, there's a lot of talk about this and some confusion. Someone watching right now could say, hey, wait a minute, I think I'm a candidate, right? Who is a candidate? Who isn't a candidate for bariatric surgery? We're going to go through some of these. We're going to show some pictures of the procedure, or different procedures. But who right now is simply someone who should just diet and exercise and is not a candidate?
Well, we have to go by official criteria as established by National Institute of Health. And those criteria have been in place since 1991. So to be a candidate for surgical intervention, you have to meet the criteria by what we call body mass index.
BMI, body mass index.
Which takes into account height and weight of the patients. So roughly, if your body mass index is 35 and above, and you have medical conditions such as diabetes, sleep apnea, hypertension, degenerative joint disease, arthritis, you are a candidate for surgical intervention, provided that you can prove that you tried non-surgical weight loss, which is diet and exercise.
Okay. Obesity itself, a disease?
It is officially been accepted as a chronic disease by American Medical Association, but it's been officially declared as a disease by National Institute of Health and Medicare Services since 1991.
But even if you don't have the diabetes or the other diseases that sometimes are often connected to obesity, the obesity in and of itself is a disease.
Correct, because if your body mass index is over 40, which roughly correlates to about 100 pounds over the ideal weight, the studies have shown no matter what diet and exercise regimen you engage, the success rate beyond 6 months is less than 5%.
Okay, let's do this. Let's go, if we could, Bob Morris, our terrific, longtime Emmy Award-winning director. Bob, if you could, and our team in the control room, put up the video, not video, there's a picture of 3 different, I believe, procedures. If you could, put them up, Bob, and the doctor will talk them through. Doctor, if we can talk them through, we can put them on the big screen, it'd be great. These are the current most used bariatric techniques. If you can talk them through, Doctor.
Yes. The currently most commonly used procedures are adjustable gastric banding, which is a purely restrictive, least invasive procedure where we put the gastric band around the top of the stomach, and through the port we can tighten or loosen the band.
Hold on. Why is that the least restrictive?
Because we don't cut the stomach, we don't reroute the intestine to the stomach. It's outpatient procedure, very fast recovery. But for the same token, since we're purely restricting how much solid food patients can eat at any given time, there is a chance that the percentage of the weight loss will be less compared to other procedures.
Is that what Governor Christie had?
I believe so.
Got it.
The second procedure is a stapling procedure called a sleeve gastrectomy. It's a very popular procedure and has very good results. We do permanently remove 3/4 of the stomach during that.
I'm sorry for interrupting. 3/4
of the stomach.
Why 3/4?
It's been established this is usually the most effective amount to facilitate durable long-term weight loss. And the third procedure, laparoscopic gastric bypass, has been in existence for over 30 years. Very good procedure, been past the test of time, is considered to be gold standard, but it has more malabsorptive side effects, and some people think it's too much.
What are those side effects?
Vitamin deficiencies, iron deficiency for younger females, and all the procedures do require long-term follow-up. This cannot be underemphasized, that surgery alone is a great step towards the healthier lifestyle, but without good, proper follow-up, I think all surgeries long-term may fail.
See, this whole JFK for Life initiative, and I've talked to Ray Fredericks, the CEO there, about that a lot of it goes beyond these medical surgical procedures. A lot of it is about fitness. A lot of it is about nutrition. Talk about that.
I think it's very important that most people who come to see me as a surgeon truly tried it all. And what really we have to understand, if it's a chronic disease, how do we treat other chronic conditions? How do we treat patients with high blood pressure or diabetes or kidney failure? You have to come a regular follow-up visit, check your labs, check the medications, change the medications. And if you look at the obesity as a chronic disease, then the success long-term of maintenance of that disease, if not eradication of the disease, is really hinged upon good follow-up. So you have to start with an assessment of the patients. What's their nutritional status? A lot of time, I think people think, well, if somebody is obese, they cannot be malnourished, but in fact, they can be protein malnourished. So you need to have a dietitian evaluate them before the surgery and engage them in changing of habits before the surgery.
But doctor, our connection to food, our psychological and emotional connection to food, I often think about that. I mean, I don't want to get into our family and its connection to food and some of the unhealthy parts of that. I mean, there's some healthy parts of it because it would bring us together, but the amounts were a different story. And the outcomes always weren't so great in terms of the impact on a lot of folks in our family. But here's my question. To what degree does your program, your initiative, deal with the behavioral aspects?
It's right there from the very beginning.
How do you deal with it?
You have a behavioral licensed counselors on staff who establish what each individual has different or common in how they interact with food. And therefore, they assess each individual needs and start making suggestions on how to change the interactions with food.
Change our interaction with food.
Correct.
So
I think we deal with food for the good, for the bad. It's just because we deal with food. I think the important thing to recognize is surgery does not take away the food. Surgery just makes you satisfied with food and not feel overindulged in food as a must happen.
So someone gets this least restrictive procedure, which is again called
gastric banding.
They could in fact, could they quote eat through it?
Yes and no. They cannot eat savory foods through it because you'll get sick. You'll get sick. But when the people say eat through it, we're surrounded by high-calorie beverages, foods which do not induce the feeling of satiety, yet satisfy your cravings because we deal with food for different reasons, not necessarily because we're hungry. It's what we call head hunger in medical community.
Head hunger.
Correct.
Translate?
You're emotional, you're depressed, you're anxious,
We're
you're
not
frustrated.
really hungry.
We're not hungry, but with food is ubiquitous and we reach for it for any reasons.
And part of the initiative is to deal with that and find other ways.
Correct. To transition them and educate. I think the key is really the word is education, because if you educate about what is the problem, why you interact in the wrong way, and you add to that a tool for weight loss, whether it's a band, a bypass, or a sleeve, at that point, it doesn't matter. Choice of the procedure is hinged on medical conditions the patients have, but ultimately that's how you transition patients to healthy interaction with food, and then you add exercise program to that, and you continue with aftercare afterwards, and that makes for a successful overall comprehensive program.
More tools. Dr. Alex Abkin, JFK for Life, I want to thank you for joining us.
My pleasure. Thanks for having me.
Stay with us. We'll be right back right after this.